Welcome to iAdvocate, a podcast series on the public policy process developed by the Emergency Medical Service for Children National Resource Center. This series will equip you with information and strategies to effect legislative change at the federal, state, and local levels. While many of the examples used in this series refer to the federal policymaking process, most of the tools and tips are also applicable at the state and local levels. In addition to taking this training, we encourage you to download and view the Resource Center's Public Policy Primer, which will supplement the content discussed in this series. In this first lesson, you will learn about the importance of engaging in the policymaking process, the difference between federal and state legislative powers, and legislative procedures used by these two levels of government. According to the Durkin Congressional Center, public policy is a decision or action of government that addresses problems and issues. Lawmakers, however, cannot and do not make informed decisions without constituent input. Many are specialists in certain areas, but not all areas. They rely upon others to provide them with the specifics of any given subject. It is up to you to promote your priorities and share your expertise with public officials. Our nation's policymaking process is multi-layered, with decisions made at the federal, state, and local levels of government. Each jurisdiction has legislative authority over different public issues. At the federal level, the United States Congress concerns itself with issues that impact multiple states or involve national interests. For example, Congress has the authority to make laws related to foreign affairs, immigration and naturalization, and economic and monetary policies, among other issues. States, on the other hand, consider issues that take place within a state's borders. In fact, under the 10th Amendment to the Constitution, all powers not granted to the federal government are reserved for the state and the people. Generally, state legislators have jurisdiction over intrastate commerce, public health and safety, elections, and issuing licenses, among other matters. Our country's system of government also allows for shared authority between federal and state governments on several issues, including law enforcement, transportation, tax policies, and matters of general welfare. Looking at transportation, states and localities are often responsible for public transit, such as light rail or bus systems, whereas the federal government oversees the interstate highway system. As another example, during a disaster, states and localities usually lead public health and medical response activities. The federal government, however, may provide financial, logistic, or manpower assistance, or may intervene when a disaster involves multiple jurisdictions. Joint federal-state programs and federal grant programs also require collaboration between federal and state governments. Medicaid, for example, is a public health insurance program for low-income individuals and families established by the federal law. While each state is allowed to administer its own Medicaid program and develop its own standards, the federal government sets minimum requirements for states regarding eligibility and services and provides oversight for the state program. It is also typical for a joint government program to share costs. For Medicaid, the federal government provides a subsidy to states based on population and demographics of the population. Under federal grant programs such as the EMSC program, the federal government awards financial assistance to states to carry out specific authorized activities. Grantees may be required to submit reports on their activities, meet certain federal program measures, or otherwise account for the use of their award dollars. When comparing federal-state laws, keep in mind that federal law is the supreme law of the land. Therefore, federal law supersedes any conflicting state laws. For example, if the federal government passes a law requiring graduated driver's licenses for teenagers, meaning they received a learner's permit at age 16 and a driver's license at age 18, a state could not pass a law allowing them to drive at any other age. Now that you have some familiarity with the legislative powers of the federal and state legislators, let's look at the structure of the United States Congress and how a bill becomes a law. Congress was established by the Constitution as one of the three co-equal branches of the United States government. It consists of 435 voting members of the House of Representatives, referred to as representatives or congressmen and congresswomen, and 100 voting members of the Senate, referred to as senators. Representatives are elected to 2-year terms, and senators are elected to 6-year terms. The number of representatives serving in the House from any given state is determined in proportion to the state's population, with each state apportioned at least one member. Each representative is elected to serve a specific congressional district or geographical area within the state. In less populous states, the district may encompass the entire state. In contrast, the number of senators per state remains fixed at 2 regardless of population. Unlike representatives, senators are elected to office to represent an entire state, not a district. There is, however, a second definition for the term Congress. Besides referring to the House and Senate combined, a Congress is the 2-year legislative period that occurs between elections. These periods are referred to by number and divided into 2 one-year sessions. Bills that are introduced but not passed by both the House and the Senate within this 2-year time frame must be reintroduced in the following Congress or the following 2-year legislative period. Congress has 2 main legislative responsibilities in any 2-year Congress: debating authorizing legislation and passing appropriations bills. Authorizing legislation establishes a federal agency or program and outlines in statute what a program is allowed to do or not do. This is often referred to as a program scope of authority. In addition, authorizing legislation provides guidance regarding the amount of funding needed to carry out a program's activities. It does not, however, provide the funding or guarantee that the funding will be at that level. Federal programs are usually authorized to exist for a finite amount of time, typically 3 to 5 years, at which point Congress may renew the program. This is commonly referred to as reauthorization. Congress also has the ability to make changes to a program's scope of authority when it is reauthorized. Congress follows a set procedure when considering authorizing legislation. First, legislation is introduced in the House of Representatives or the Senate and assigned a bill number. Any member of Congress can introduce legislation. Next, the legislation is referred to the House or Senate Committee of Jurisdiction. For example, an education bill would be referred to the committee handling education issues. The committee may hold a hearing on the bill to understand the scope of an issue or the effect a bill might have on the population. The committee will then mark up or edit the bill, vote on the bill, and report it or pass it on for consideration before the entire House or Senate. After being reported out of committee, the House or Senate may debate, amend, and vote on the bill. After the bill is passed by one chamber of Congress, it is sent to the other for consideration. If both chambers do not pass the bill before the end of the 2-year session, it dies. It must be reintroduced in the next Congress or 2-year legislative session to be reconsidered. If both the House and the Senate do pass the same version of the bill, it is sent to the President. The President may either sign the bill into law or veto the measure. 2/3 of the House or Senate can vote to override his decision, however, in which case the bill becomes law. While authorizing legislation sets suggested funding levels for federal agencies and programs, the federal budget and appropriations process allocates money to each program. Congress must complete the budget and appropriations process each fiscal year, which begins on October 1 and ends September 30. Therefore, as a general rule, federal programs receive an appropriation 1 year at a time, and any program's funding total can change from year to year. The first step in the budget appropriations process is the release of the President's budget request. In early February, the President puts forward detailed funding recommendations for federal agencies and programs for the upcoming fiscal year. The budget request is not a bill or law and does not appropriate funding. Next, Congress drafts a budget resolution, which outlines its financial priorities for the coming fiscal year. In contrast to the President's budget, the resolution does not make funding recommendations for federal programs. Instead, it sets general spending limits on federal activities. For example, the resolution establishes a budget cap for the entire Department of Health and Human Services, but does not recommend how to allocate the amount among individual programs within the department. Although Congress votes on the budget resolution, typically in April, it is not signed into law by the President. Appropriations bills provide funding for federal agencies and programs on an annual basis. A single appropriations bill may provide funding for multiple federal activities. For instance, the Department of Labor, Health and Human Services, an educational appropriations bill fund program within these 3 departments. The House and Senate introduce and consider their own versions of each appropriations bill. Traditionally, however, all spending bills originate in the House. In other words, the House introduces its version of each bill first, and the Senate follows. When considering appropriations bills, Congress must follow a procedure very similar to the one they follow when considering authorizing legislation. The process is explained in detail in the aforementioned Public Policy Primer. Ultimately, the two chambers must come to an agreement on a final version of each spending bill before it can become law. The funding amounts in these final measures often vary from the amounts included in the President's budget's request. Again, appropriations bills are the one legislative item that must be enacted each year. Since federal agencies and programs receive funding one fiscal year at a time, they would shut down if they did not receive an appropriation before the beginning of the next fiscal year. Many times, however, all of the appropriation bills are not signed into law by October 1, the beginning of the fiscal year. To keep the government running, Congress may pass the Continuing Resolution, or CR. A CR funds agencies and programs, usually at the previous year's level, for a finite amount of time until the appropriations bills are enacted. So far, we have discussed the process of legislative policymaking. Complementing this is the process of regulatory policymaking. Congress sometimes passes laws that purposefully lack detail, leaving it to the various executive branch agencies to issue rules and regulations defining how the laws are to be put into practice. For example, Congress may pass a law giving the Department of Health and Human Services broad authority to improve vision care for newborn. It is up to experts within the department to draft specific initiatives to improve such care. These initiatives are formally known as regulations. Proposed regulations are published in the public document known as the Federal Register and open for public comment. At the end of the comment period, an agency will consider the comments and publish a final regulation on the issue, which has the effect of the law. Many of the principles you have learned regarding the federal policymaking process can also be applied to state policymaking. Remember, depending upon the issue, you may find yourself communicating with state legislators instead of federal legislators. All states except one have legislatures that are bicameral, meaning they consist of two chambers, the House of Representatives, sometimes referred to as the House of Delegates or the Assembly, and the Senate. Only Nebraska's legislature is unicameral, consisting of one chamber. States follow a legislative process similar to the federal process. Legislators introduce bills, which are then referred to and considered by a relevant committee. After committee approval, the bill must be considered by both legislative chambers. If both chambers pass the version of the bill, it is presented to the governor. At the state level, the executive branch is run by a governor, who serves as the chief executive officer of the government. The governor oversees numerous agencies, commissions, and boards, and has the power to sign or veto legislation. A state's executive branch can also make policy change through the regulatory policymaking process. As with the United States Congress, state legislatures may also pass laws that are purposefully lacking in detail, leaving it to the state's various executive branch agencies to come up with the specifics of the law through rules and regulations. Proposed regulations are published in a public document and are open for a public comment period. At the end of this period, comments are considered and a final regulation issued. Thank you for joining us for this lesson on iAdvocate. To learn more about the concept discussed in this lesson, please refer to the Public Policy Primer, a guide on the legislative process and impacting change at the federal, state, and local levels, available free for download from the National Resource Center's website. In the next lesson, you will learn about the rules of advocacy, including the difference between lobbying and educating and informing, as well as guidelines for communicating with policymakers.